series. Now, individuals who are at heightened risk for serious outcomes from COVID-19. Indeed, this group is estimated to include less than about 3% of both the US and the Ohio population. Immunocompromised people are recognized to be at a much higher risk of severe outcomes from COVID-19. And more recent data now indicates that they may not develop a sufficient immune response from the primary 2-dose mRNA vaccination series. These individuals have a reduced ability to fight infections and are particularly vulnerable to COVID-19, especially as the more contagious and more dangerous Delta variant is driving a surge in cases. The purpose of this additional recommended dose is to strengthen the immune response when that initial immune response to the primary vaccination series may not have been sufficient. Now, this additional mRNA vaccination dose, combined with other prevention strategies, where it is driving a surge in cases and maintaining physical distance, offers another important layer of protection for this small but important population. Now, the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practice, the ACIP, features some of the nation's leading medical and public health experts. And it's really been their role, their responsibility to develop recommendation for the use of vaccines for a very long time. And after reviewing all the available data regarding vaccine safety and efficacy, including data related to the Delta variant, the ACIP has recommended that people with very impaired immune systems extend their primary mRNA vaccination series to include this additional dose. Now, the group for which this recommendation applies includes conditions like those who have had transplants of various kinds, those who have conditions that either as a result of the condition or the medication associated with that have severe immunosuppression. And that would include some cancer patients, people with advanced HIV, or other specific conditions. The ACIP is working to further define who falls into this very specific category and has told us that they'll be sharing that information with healthcare providers and the public as quickly as possible. The ACIP has recommended that for those receiving this additional dose, it be administered at least 28 days following the completion of their primary 2-dose vaccination series. And again, it would work much as other vaccines work in terms of the recommended ages, with Pfizer being a vaccine that can be applied for those ages 12 and older, while with Moderna, we would continue to apply that vaccine to those 18 and older. At this time, an additional dose is not recommended after the single-dose Johnson & Johnson vaccine. Further evaluation and guidance specific to the Johnson & Johnson vaccine is pending. Now, those who believe they may meet the criteria for this additional dose are urged to consult with their healthcare providers to determine next steps. The patient's clinical team can really best determine the degree to which their immune system response might be altered and help them determine the optimal timing of an additional dose based on other ongoing medical therapies and treatments. It's very important to note, however, that the data for the rest of the population continue to indicate that we are developing a very satisfactory immune response to the 2-dose mRNA vaccination series, and that most people maintain excellent protection, especially from serious illness or death, and therefore do not need to extend their primary vaccination series or add a booster at this time. Now, rest assured, the ACIP, along with the larger medical and public health community, is carefully watching the real outcome data that is emerging every day to see if any evidence suggesting the need for a booster emerges. And they're looking especially carefully at the data for older Americans because we know older Americans are particularly vulnerable to severe COVID-19 infections. But at this time, there is no indication or need for populations outside of this very narrow category of those with known impaired immune systems to be seeking an additional dose of the COVID-19 vaccines. Now, at this time, I'd be happy to take your questions regarding this new indication.
Thank you, Dr. Vanderhoff. Your first question is from Dan DeRosa, WOIO.
Hi, Dan.
Hello there. Thank you for taking the time to explain this for everyone. Doctor, I'm wondering if you could give us an idea, what will people's reaction be to a third shot? Is it like other vaccines in the past where you may not even notice a reaction this time?
Yeah, the ACIP looked very, very carefully at the safety information and determined that there was really no reason to believe that adding an additional dose would in any way pose a greater threat to these individuals who admittedly, do have impaired immune systems. So that was a very, very serious consideration. And the data certainly do not suggest any reason for that to be a concern for these individuals as they approach the decision about receiving that additional dose.
Thank you. Your next question is from Tom Bosco at WSYX.
Hi, Doctor. So in saying this, what can you say about the future of a possible booster shot for the people who are outside of this very small population? Does this preclude that, or is that still possible coming up?
Yeah, I would say that it's really two very different situations, two different questions almost. What the data indicated that led to this recommendation was that after very careful review, now many months after the administration of the first two-dose series, that there was a portion of the population for whom the data seemed to be telling us they were not developing the same kind of robust immune response that is seen in other populations. And this really was not entirely surprising because of what we've learned about how particularly the mRNA vaccines work, and that they do trigger what is known as cellular immunity. That's that adaptive memory kind of immunity that has proven to be so important against COVID-19. But even in those without impaired immune systems, it really happens after that second dose. And so as we look at this population, a population whose cellular immunity tends to be more limited, tends to be impaired, the need for additional doses, more oomph from that initial vaccine series was very clear. Now that's one situation. The other is, well, what about for the large majority of Ohioans and Americans who the data clearly shows there is the development of robust immunity, robust cellular immunity. And there it's more a question of how long does that immunity last and how well does it hold up in the face of new variants? Well, the good news for us is that study after study after study is demonstrating that the vaccines continue to provide all ages with very strong immunity, especially in terms of the primary endpoints, the issues most concerned, which is serious illness, hospitalization, death. There is some evidence that doesn't surprise the medical community that these vaccines, which based on their design, one would expect these vaccines do have some level at which the vaccinated can develop symptoms. But it really appears that their immune systems rapidly respond to that exposure. Those symptoms are relatively mild or moderate, and then they get over it. So bottom line is two different questions. The data so far strongly suggest good continued immunity for most of us based on that 2-dose series, but we continue to watch this very closely. And if that situation is changing, we will respond and get further guidance out to people promptly.
Your next question is from Jackie Borchert with the Cincinnati Enquirer.
Thanks. Happy Friday. I'm just wondering, speaking more generally about vaccinations and kind of our rate, which we've seen pick up in the last couple of weeks, are we at a point or nearing a point where infections are outpacing our vaccinations? And if not, do you have an estimate on when that might be the case?
Well, I think that what I would say, the way I would characterize it is this. We still need to get more Ohioans vaccinated if we want to avoid continuing to confront these surges that we have been seeing over and over. Our current surge is being driven by the Delta variant, and it's a variant that is incredibly contagious. It's very infectious. I've said before, it's more contagious than things like the cold or the flu. But here's the twist on that. It's more contagious and it's also more severe. This is a much worse virus than the common cold. This is a bad virus that causes inflammation in our blood vessels, in our organs, as we know, lands a lot of people in the hospital and unfortunately has caused a lot more death than we've seen with either common cold or the flu. So two really competing things. One is, well, how fast is this virus spreading? Well, it's spreading very fast, but you know who it's spreading among? The unvaccinated. We are not seeing rapid spread of this virus. In fact, the virus appears to spread very rarely among people who are vaccinated. And then it's only during apparently a very brief window when their immune system is kicking into gear and responding to what has gotten into their nose. So it's a very brief window, whereas it is spreading like wildfire among the unvaccinated. What we really need is to protect more Ohioans from this by getting vaccinated.
Your next question is from Madeline Fenning with WCPO.
Hi, Dr. Vanderhoff. I was just wondering if you could talk about, there are some nurses and other hospital staff who work with and around immunocompromised patients who are pushing back against requirements from their hospitals to get the vaccine. Can you talk about the risks associated with having immunocompromised patients being taken care of by unvaccinated hospital staff, even after their third booster?
Well, what we have said over and over again is that your best personal protection against COVID-19 is vaccination, but it's also the best protection for those you are around. And that includes family and friends. If more of us were fully vaccinated, this Delta variant wouldn't have the opportunity to be spreading like wildfire in our population. And those of us who were vaccinated would really be putting a wall of protection around those who could not, for one reason or another, be vaccinated. So we continue to strongly recommend vaccination. And we also recommend that even the vaccinated, when they are in high-risk situations, are at particularly high risk themselves or working with those who are at high risk, layer additional protections on, including masking. So, that has been our consistent guidance and recommendation. And I would simply say to those who are in that situation that we would strongly encourage them to consider that guidance.
Your next question is from Alan Henry with NBC4.
Good afternoon, Dr. Vanderhoff. I was wondering if you could narrow down on the J&J vaccine recipients. Can you tell us about how many Ohioans have received that shot, and what's the advice for those people who might have gotten that shot and be immunocompromised?
Yeah, the vast majority of people in the state of Ohio, like across the nation, have received one of the mRNA vaccines. But the J&J vaccine is a very different vaccine in terms of its design, in terms of the way it works. I mean, one good indication of that is the fact that the J&J vaccine is one dose, and we have recommended it as one dose from the start. So it's really not an apples to apples comparison. We have to look at these two families of COVID-19 vaccines a little differently. And so we're looking at the data very specific to the kind of vaccine in question. And thus far, there simply has not been the kind of data that clearly indicates the need for an additional dose in the primary series for these immunocompromised individuals. Now, we're continuing to look at it, and recommendations could change as more data emerges. But we have had indications, for example, from other studies, not with the immune-compromised population, but with the general population, that has shown, that has suggested that over time, the Johnson & Johnson vaccine may actually have some increase in its impact, in its effect, which is very interesting and is unique to that particular vaccine. So it's a good question. At this time, there is not a recommendation that people who've received the Johnson & Johnson vaccine add an additional dose to that primary series. But if there's any doubt in a person's mind, if they have any questions, they should really speak with their healthcare team about their particular situation, because everyone's medical condition and everyone's medical situation is somewhat unique.
Your next question is from Justin Dennis with Mahoning Matters.
Good afternoon, Doctor. Thanks for taking the time to talk with us. I think this question might have been asked in a prior conference, but I'm just wondering, as new variants emerge and continue to mutate, at what point will these companies have to go back to the drawing board to kind of reinvent the vaccine? Would they have to start over? Could we be getting a completely different vaccine tailored to whichever the dominant variant is next year? And at any point, could these mutations outpace vaccine development?
Well, those are excellent questions. And what has been happening is that in the background, many of the researchers and the manufacturers have been developing additional doses. They've been developing boosters specifically with the more recent variants in mind. Now, keep in mind, the current data, as I said before, continues to show that the vaccines that are currently available and that many of us have received continue to do very well, not just in the United States, but globally, against all the variants that we've encountered, and very specifically against both the Delta variant and the Alpha variant that preceded it here in Ohio. But that said, we've not been resting on that. We may never need a booster vaccine. But if we do, the manufacturers have been actively developing and testing boosters that are designed to incorporate elements of the spike protein that has been found in the more recent variants. So it would be almost an augmentation of the vaccine that was seen previously. So excellent question. The scientific and medical community is thinking ahead that way and is well prepared, but at this time, that does not appear to be something that we need.
Your next question is from Curtis Fuller with WLWT.
Thank you very much. Good afternoon, Doctor. You said you would urge people to consult with their physician. Will their primary doctor administer the third dose, or will they be able to go to a pop-up clinic like people do now? And if that's the case, what, if any, evidence would they have to show to justify them getting the third dose?
Excellent question as well. It's very, very important that people be able to have as ready access to vaccines as possible. And both the FDA and ACIP have reiterated that access to one of these boosters will not require a prescription from your doctor. Rather, people can continue to receive vaccines through the channels that they've been accustomed to receiving those vaccines through. Now, it is very important to remember, if you're a patient who believes that this might be the best option for you, that when you receive a vaccine can be a very important decision in terms of the other medicines you might be taking. So we really do strongly recommend that people who believe that they fall into this category consider consultation with their provider or a member of their provider team to explore, is this the right decision for them? And if it is, what's the best timing? Now, I did share that the minimal interval that is recommended by ACIP following the completion of the 2-dose series is 28 days, but there could be further adjustments or nuances that the team might want to work out with the patient who might be receiving other medications as well. In terms of the channels or the places that people can go to receive vaccines, all of our existing channels remain open to people, whether they've received vaccine through their pharmacy, if they've received it through a local health department, their physician's office, a healthcare institution, and all of those remain viable options.
Your next question today, which is the last question for today, is from Laura Hancock with Cleveland.com.
Hi, Dr. Vanderhoff. I was just wondering, how are you going to prevent just anyone from going in to get a third shot?
Well, we do not, we have not had a regulatory or policing function for vaccines to date. And our data certainly does not suggest to us that there have been large numbers of people who have been pursuing additional doses beyond the recommended number. We would strongly discourage people who do not fall into this narrow category from getting an additional dose for the simple reason that the data don't suggest it's necessary. What we are recommending with this additional dose is that people with immunocompromised conditions appear to not generate the robust initial immune response that the vast majority of the rest of the population do develop. And therefore, really what we're saying is their primary series should probably be a 3-dose series. Whereas for the rest of us, our primary series is a 2-dose series, and that is more than adequate. This recommendation is not a booster dose recommendation. It's an adjustment to it's an extension of the primary series recommendation. And so going and putting yourself through getting that additional booster dose at this time would not really seem to be neither necessary nor prudent. And so I would would discourage people from doing that now. Well, I'll close just by again thanking you for your time and attention. This is very important information for us to share with the people of Ohio, especially those who may fall into this relatively small category of patients in our state, but it is very important information for them and for their providers. So thank you for your help, and thank you for all you do every day to help educate the people of Ohio.
Thank you very much, everyone. Thank you, Dr. Vanderhoff. As a reminder, if you need a copy of the recording, please send myself or Alicia an email. Thank you very much for joining us.